The opioid epidemic really started with four things coming together. First, we had a reputable article in the Journal of Pain saying that opioids are safe to use for acute pain and that we should use them whenever anybody had pain. Number two, we had the drug companies making new and stronger and longer acting opioids. Number three, we had the Veterans Administration and the Joint Commission come out with saying that pain is the fifth vital sign and we should measure that and treat that on everybody. And at the same time, in this 10-year period, the Mexican cartel started delivering black tar heroin to every major city in the United States. And people who could not get their opioids were using heroin. And we started seeing a large number of deaths occur from this epidemic. The ALTO program started in January 2016. ALTO stands for Alternatives to Opioids, and the goal of the program was to treat acute pain aggressively, to manage acute pain, and never rely on opioids unless it was absolutely needed as a last resort. Prior to development of ALTO, emergency physicians really only had three options. They can give somebody Tylenol, they can give somebody Motrin, or they can reach in deeper and pull out Percocet or oxycodone. ALTO supplied more tools in the toolbox, more options for the emergency physicians to use. In the first year, we had a 57% decrease in opioid use, and by the end of the second year, amazingly, an 82% decrease in opioid use and prescriptions from the emergency physicians. But what we realized is the protocols and the philosophy and the culture behind developing ALTO actually would work throughout the House of Medicine. Every chairman of every specialty is coming up with their own protocols. In the OBGYN department alone, they've had a 50% reduction in opioid use after surgery and after C-section. And we are expanding that out of the emergency department and being able to get patients into detox and recovery by not only giving them medical assisted treatment, but giving them a warm handoff to a recovery center or detox center. The ALTO program has been so successful at St. Joe's that hospitals have instituted ALTO throughout the country. Just recently, I testified in Congress with a House bill to help spread the ALTO protocols throughout the entire country. And the most important part is we're now treating our patients better. We're treating them without opioids. We're not risking addiction or dependency. And we are doing the right thing for society and for us as emergency physicians.